My name is Tchelebi, and I am the physician here at Park Avenue Medical Spa in Armonk. Today I will be talking about the RHA family of fillers. This is a very resilient hyaluronic acid which is great for dynamic folds and wrinkles. At the end of the presentation, I will be taking questions, I will be offering a special promotion, and I will be giving away a free treatment. So stick with us to the end for our live chat and more details. Is a hyaluronic acid filler, and it is formulated for dynamic folds and wrinkles. It does mimic the hyaluronic acid which exists normally in our body, and when it is injected, it adapts to facial movement. It is natural. There will be no bumps, no clumps. It is very versatile, and it has a few different products, RHA 2, 3, and 4. Each one has its own indications, and I will be talking more about each one of them. They have less cross-linking, longer chains, and that makes them much harder to be destroyed by the body, so they're going to last longer, and they are ideal for dynamic folds. This is one of the reasons for which I introduce them to my practice, to my patients. It is important to have different kind of fillers that are great for different corrections. By adding the RHA fillers, I can correct dynamic folds and wrinkles, enhance cheeks, augment lips, or just correct very fine lines or wrinkles. The RHA collection of fillers comes with the RHA 2, which is ideal for fine lines. It is more elastic. It's going to move easy with the expression line. The RHA 3, which is good for lip enhancement for areas that require a little bit more volume. It has both strength and elasticity. And finally, RH 4, which is ideal for deeper folds, for lift, for cheek enhancement. It has more strength than elasticity. With superficial to deep dynamic folds and wrinkles is a good candidate for this product. Patients who would like to just have cheek enhancement or just lip augmentation, more of a jaw definition, a lift, or just softening of their fine lines would be a great candidate for this product. As far as results, the results are immediate. You may, however, feel this product for a couple of weeks, but with time it becomes part of the tissue and you will no longer feel like anything has been injected. There could be some bruising immediately post-injection, maybe some swelling, but the side effects are very temporary. We do not recommend that you do any vigorous exercising. Obviously, ice will always help to decrease the inflammation and any bruising if it's going to occur. We do not recommend that you take any NSAIDs or any kind of product that would cause bruising. No blood thinning products prior to the injection or at least a week post-injection. So in this situation here with Nicola, what we are going to try and do is try to lift, do a bit of cheek enhancement, and even fill in some of the loss of volume around the temple in an attempt to reduce the fold that she has here, and maybe also some of the jowl. And for that, I'm going to use RH4 because it is a more of a volumizing, strengthening type of a filler. And I think it's going to do a great job for what we are trying to achieve here. I will also be using a cannula, so in that way we will reduce the bruising and also keep swelling at a minimum. Point of entry, using this little sharp needle, and then insert the cannula. We'll just add here a little bit more and try to improve a bit. And this has also given us a much nicer, a little better jaw definition, even though we will have to maybe here do more of a chin enhancement to get a better, sharper, nicer jawline. But for the purpose of our consultation today, we'll primarily just concentrate on the lift with the cheek enhancement. So now I will be working on the other side. So now we can see she has more cheek definition, and there is a reduction also in the jowl on either side. A sharper line down here, and a nice lateral projection, and also being able to achieve some filling in the temporal region. And this was done with 1 syringe of RH4 on either side. Next, as I mentioned, will be improving in this location, marionette line, and do a little bit more of a chin projection, which is going to help with the better, sharper jawline, and we can achieve that with RH4 as well. You can also check your texts and respond yes to schedule an appointment. If you do schedule an appointment prior to January 31st, you will be able to save $100 on your first syringe, $125 for a second syringe, and $150 for a third syringe. We do now invite you to chat with us, ask any questions through the question box. We'll be choosing one lucky winner to receive a free treatment. Thank you again for being with us and watching this presentation. Hello, everyone, again. Thank you for being here and listening to my presentation. And now I will be answering some questions. The first questions I have here is regarding events. If you have an event coming up, how soon should I do the filler? Generally, 1 week is sufficient, unless obviously there is more serious bruising that require additional time. It is rare these days because with most or in most cases, I do use a cannula, as you saw in my presentation, and that prevents really very bad side effects with increased bruising or even swelling. As I mentioned previously, I think it is important that you avoid taking aspirins, Advils, anything that contains ibuprofen, NSAIDs, obviously, things that can increase bruising. And then obviously icing, it's important. And arnica is also very helpful. The other question that I have here is if RHA can be added to other fillers. And yes, it is very common, and I do that a lot, either using different kinds of RHA fillers or combining them in certain situations, depending on the face, depending on the needs, depending on what we are trying to achieve. I can either use that in the same setting, or if someone used different fillers in the past, I can use the RHA filler. So there's no contraindication in combining different types. If it is, let's say, Sculptra, which is a completely different product, it is a lactic, or let's say hydroxyl apatite, like in Radius, and that can be always combined with the hyaluronic acid. So yes, the question is absolutely yes, we can always mix and match. Another question is, if I book a consultation, can I get filler the same day? Yes, it is important though that you mention that you would like to have the consultation and also the filler in the same day so that we can allot sufficient time. I usually prefer, if you are okay, to using some anesthetic cream because that also helps, even though all these products contain an anesthetic in the formulation. So once I start injecting, it really becomes a lot more comfortable. So it is not absolutely necessary to use an anesthetic cream. If I only inject in the lips or the surrounding around the lips, it all depends on the situation. If you have good anatomy and I don't need to do any fillers in the borders, or if you don't have any fine lines, then obviously I'm not going to do that. However, if I need to enhance the vermilion border or create more a Cupid's bow, or if there are smoker's lines, I obviously will do both. I have to maybe enhance the volume to some extent because there has to be a proportion between the white portion of the lip and the red portion of the lip. So it is very important that that ratio is being maintained so that you end up with a very natural look. I am pretty conservative. Everybody that has come here, they know that. I don't like to over inject. I am much more for a natural look and also for gradual enhancement. So I don't mind starting with less and then we continue if we like the result. And we always, it is a conversation between me and everyone that comes here. I like to ask the opinion, we discuss the result, and then if we agree, then we'll just proceed. I also show results during the treatment so that we feel comfortable with what I am doing and what it is that you would like to see at the end of the treatment. What do I suggest to do before getting the RHA to help reduce bruising? So I touched on that a little bit previously. So obviously, if you're someone that is taking regularly aspirins or any kind of other anti-inflammatories, I do recommend that you stop that minimum a week prior to treatment. And then obviously Arnica Forte, it does help. Sometimes, depending on the situation, I would recommend that you start that a few days prior and you continue after. but definitely extremely important is to stop the use of anything that would enhance the possibility of bruising. There are also some supplements, and whenever you call and want to make an appointment for a consultation, my staff is generally very good at reminding everyone of which are the products that you should stay away from prior to having injectables. And that goes also for Botox or any other injectables. Can this help my resting set face or my lips turn down and corners now that I have gotten older? It definitely can, and that's the great advantage of the RHA, that it comes in different consistencies. There are the ones that are not very viscous, and that is the RH2, and then we have the ones that are a little bit heavier and have more volume, more body to that. So oftentimes I may need to combine them in order to achieve, and again, it depends on the individual. It depends on the depth of the marionette line. Unfortunately, not a very nice name for this. But yes, definitely it would be a good filler for that location. Uh, the the time for the results. So usually if you achieve the right correction, meaning that we're able to reduce the let's say jowl or marionette, or create the lift or improve the jawline, then I like to be more conservative. I'm saying a year, maybe 12 months. I know that the company has posted on their site 15 months. It depends in certain situation. Obviously, if there are other type of treatments that one does to maintain and enhance collagen and reduce or the speed with which aging happens. Obviously, a younger person, it's going to last longer than somebody that's older and somebody that just depends on fillers to achieve facial rejuvenation. Serious under eye bags. Look, will this make serious under eye bags look smaller? Not really. I think someone that really has serious eye bags, the only treatment for that would be surgery. And that's the other thing which is important. And there are situations, and I do see people that come to me, and I just have to be honest and tell them, in case I feel that the filler is not going to be the right treatment for them, and then maybe surgery is going to be the right procedure. And also, I think it is important for someone that is thinking of doing non-surgical treatments. You can't compare. In certain situations, you can get excellent results, but it's not necessarily a replacement for surgery. Can this be used for under eye? Yes, it can be used for under eye, the so-called tear trough. And I do use RH2 for that. I actually like it. It's the only one that I really like for this location. I find that it injects very smoothly. I rarely have any bumping or lumps, or it does not show. I never noticed the so-called Tyndall effect, which you notice a bluish discoloration, and that happens with a lot of the other HA fillers. So absolutely, yes, it is one of the best fillers to use in that location. How many syringes does it take to see a difference? And this is a great question, and I think it all depends on what we are trying to achieve on the individual. There are certain situations where one syringe is sufficient, and there are others where I can do 5 or 6 or more syringes. So it is different from one person to the other. But I think, and I do see this a lot, people are coming to me scared because they see bad results on other people, and they are concerned that this would happen, and everybody tells me I don't want a lot, I want a little. It's important to know that one syringe of filler doesn't really take you very far, and it is rare that I do use just one syringe. That's usually in very young people where there is not a lot of laxity, if there is not a volume loss. So in many situations, I do have to go to two, three, or more syringes. Does RHA last longer? RHA lasts pretty much as all the other hyaluronic acid, and again, it depends on the individual. And certain ones, it can last longer than in others, but pretty much I think it is a temporary filler, so you're not going to get very long-term results from it. It is great in areas where you want to maintain movement because it really moves with the tissue. And I rarely had people coming to complain that this is that feels like a lump or an unevenness, or so. From that point, it is my favorite type of filler. Do you leave with bumps and make right away like with D-Sport? Would this be better for small forehead lines over doing D-Sport? Filler would not be a replacement for a neuromodulator. And generally, if you do get any type of bumps post D-Sport or Botox, those are very short-lived because it is just happening because the injection is very superficial, and it should be that way. You should not have an injection of D-Sport or Botox deep. In the past, we used to be taught to inject up until you feel bone. That's really not a good technique. So with D-Sport or Botox, people do sometimes notice little bumps. It's almost like if you ever had like a TB vaccine, or you would have that little wheal, but that disappears by the time you leave the office. With fillers, you should really not see any unevenness. You may feel that there's something there because obviously you're feeling a depression with a filler. But definitely the first approach, if you have lines in certain areas and not everywhere, because you cannot do filler absolutely everywhere, but I would start with a neuromodulator to decrease the intensity of the motion, and then you can inject a filler if necessary to improve the line and wrinkle. The good thing about it is that once you do the neuromodulator, the filler doesn't have to be done every time you come in for a neuromodulator. How long does this last? This product is good for the jawline. So as I mentioned previously, it is a great product, the RH4 primarily. It is good to use in jawline. And how long does it last? Again, as I mentioned before, being conservative, I would say 12 months would be a good time to have still the result. Not sure, but I do have situations where people come to me after a year and a half, and I can still see that there is some remaining filler. You mentioned to me yesterday I need to maintain a 6 to if I need it prior to 6 months. Can it be done, or it is too soon? If I did mention that it lasts 6 to 9 months, most probably I've been discussing this with someone who wants lip enhancement or just a rejuvenation of the lip, because the lips, since it is a very dynamic area, we use our lips all the time and a lot, obviously, it will suffer an enzymatic destruction a lot quicker than other sides, for example. So yes, it is possible that in lip you may need to do it after 6 months. Sometimes with lips also what I do is I may start with a lower amount of filler, and then just because sometimes people come with not a lot of lip, they are concerned. So oftentimes we start maybe much more conservative. And then let's say that'll be the situation in which maybe a month later, once the inflammation or the bruising, or a few weeks later, we may add more if we like the result. Um, when you start to use this filler in your lips for lumping, does it then cause a sag if you don't want to do it again? What's the long-term effects of filler? No, you are not going to see any difference. Basically, your lips are going to return, or any area where filler is placed, it's going to come back to what it was before the placement of the filler. So you should not be at all concerned with that. There are some specials that we are running. I know everyone is very interested in finding out, and I think we've already posted with my during my presentation. I think you've heard that we do offer, depending on the number of syringes. With one syringe, I think we have $100 off, and maybe 250, and maybe 3 syringes, we have $200 off at this time. So please check with my office, call, and they'll be able to provide for you what is the pricing, and if we do have any specials. We do run regularly specials for our fillers and all of our other treatments. Please let me know if there are any other questions. I'll be more than happy to answer. Everyone will receive a text, and if you are interested in having a consultation, please reply yes. I would love to see you, and hopefully I'll be able to answer any other questions that you may have. Thank you. So sounds like we are getting to the end of our questions, and I thank you again for spending this time with me on a Friday prior to holidays, and I wish everyone happy holidays and a very happy new year.